here with RegisteredNurseRN.com, and today I want to talk to you about the two main types of compression stockings that you will encounter as a nurse. There are two types of compression stockings. Before I started nursing, I would always hear of nurses wearing what they said TED hose. So whenever I went to go buy my pair of compression stockings, I figured out that there's a difference between TED hose and compression stockings. First, I want to talk to you about TED hose. TED hose, TED stands for thromboembolic deterrent, which means that they prevent blood clots. As a nurse or a nursing student, you've probably seen these on patients. Physicians usually order this after a patient's had surgery because patients who have had surgery are normally in the bed for a while and they're not up walking. So when you're not walking, blood is pooling in your leg, which puts the person at risk for a blood clot. So what TED hose do are prevent blood clots. They're made for people who don't walk. They're only good for about 3 weeks and then they lose their compression. You can get them in thigh high, knee high, and they generally come in the white color, and some are open toed and some are closed toed. So also you would want to use a TED hose is if a patient has a lot of fluid in their leg, like with congestive heart failure. So for a nurse who's on their feet walking, TED hose is not something you want to wear on the job. Instead, what you want to wear are what are called compression stockings. Compression stockings have different compression ratings. They have, first rating you can get is 15 to 20, it goes to 20 to 30, and then 30 to 40. Anything higher than that it's really tight and probably uncomfortable, and you would have to get a prescription by a doctor for that, but you can get these over the counter. Normally, the recommendation for a nurse is just 15 to 20 compression rating. It's sufficient enough. So how does a compression stocking work compared to the TED hose, which just prevents blood clots? So compression stockings are made for people who are up walking. When you're up walking, your calves are squeezing the blood. But when you're on your feet for long periods of time and if you have venous insufficiency, you're at risk for varicose veins or lymphedema, fluid likes to pull down to the ankles, and whenever that happens, that causes the vessels to burst and break, which can cause spider veins and varicose veins. So with the compression stocking, you have the compression at the ankle, okay? So these are 15 to 20, so the compression will be here. And whenever you walk, that little bit of compression will help guide the blood up so the blood won't pool and bust your veins. So as a nurse, compression stockings are definitely the way to go. Before I started nursing, I actually worked fast food, and I was on my feet for long periods of time, and I would notice that my legs would hurt really bad after my shifts, and I started to develop spider veins on my left leg. Well, whenever I became a nursing student, I heard other students talking about buying compression stockings. So I invested in a pair, and I have worn them ever since my whole nursing student career and while I've been a nurse, and I have noticed a huge difference. My legs don't hurt anymore, and I don't have any varicose veins or spider veins, and I have a huge family history of varicose veins, so I haven't developed any. So compression stockings are great for that. And one time I didn't wear my compression stockings because I had worked 4 days in a row and my compression stockings were dirty, so I didn't wear them. And I came home and my legs were absolutely hurting me, and I couldn't even sleep at night because they were so bad. So I've never repeated that before. I actually got an extra pair so that would never happen to me again. So if you're a nurse and you do get the tired legs, you have a huge family history of varicose veins, I would definitely invest in a pair of compression stockings. You can get them at your local nursing supply store, or you can get them online. If you do choose to buy them online, make sure you measure your calf and your thigh. Like I said, you can get these in thigh high or knee high, different colors, black or white, so whatever you want to get. But that's a little bit of a difference between the TED hose and compression stockings. Just a recap, TED hose is something you probably don't want to get as a nurse because it's more for the non-ambulatory patients. They only last for 3 weeks. Compression stockings are for people who are up, walking, moving like nurses, and they last for about 6 months. So after 6 months, you want to get a new pair because they're not have as much compression as before whenever they were new. So there you go, and thank you so much for watching. If you have any questions, please come to our website, RegisteredNurseRN.com, and use the form to ask any questions. And thank you so much for watching.